Hey, good afternoon, everyone. Hello and welcome. My name is Justin Rivas, and welcome to this County Health Rankings and Roadmaps 101 webinar, which is including a tour of our website. I'm a community coach here at County Health Rankings and Roadmaps, and today I'm joined by my dear colleague, Ms. Jan O'Neill.
Hi, everybody. Good to be on. And also I want to let you all know that if you check the handouts section of the control panel, you will see handouts for today. So that's a place to look for that.
Thanks, Jan. So as we go through this presentation, we'll be taking turns, Jan and I, answering your questions, as well as sending out links via the chat box. So Jan, you want to start us off?
Great. So thanks, Justin. Yeah, we want to start with giving you all a context here. We are a collaboration between the University of Wisconsin, where Justin and I are based in Madison, Wisconsin, at the Population Health Institute, and the Robert Wood Johnson Foundation. So this program is brought to you by that collaboration, and we are very grateful to be here, and thanks to them, that's why this webinar is free and available to all. So if you can go to the next slide then, Justin. So on the next slide, you'll see how the webinar interface works. On the left, you'll see our screen, and on the right, you'll see the control panel. And as I mentioned at the beginning, we've posted some handouts. So if you look in the handouts section there, you'll see our slides for today, as well as some chat links. And if you want to communicate with us, we encourage you to ask questions through the question box there, and we will get back to you, if not right away, we'll get back to you shortly after you've asked your question. There will be time during this webinar to ask questions throughout. We are going to pause throughout and look for your questions, so please be sure to post those there. And on to the next slide. The basic agenda here is that first Justin's going to give an overview of County Health Rankings and Roadmaps, and then talk a little bit about our 2017 rankings release, what's new. I'll be then giving a live web tour of our newly revised site, and then we'll go over some additional tools and resources and have some time for Q&A. All right. So our guiding.
Well, thanks, Jan. I'll take on over here with our guiding question for this afternoon. So how can County Health Rankings and Roadmaps help you build a culture of health in your community? The Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles, regardless of where they live. So not long ago, America viewed health as a doctor's office, isolated from daily life. But today we know better, and research gives us a better understanding of how interconnected health is with things like income, education, housing, and a lot of other factors. There's tremendous need to shift from this old lens of working in silos in the community, since we're finding out that only a cross-sector approach can fully address these intertwined and complex issues. Each one of us is a piece of the puzzle of building a culture of health, and the hope and vision of a culture of health has to be shared, and the circle of engagement needs to be extended to the whole community. The truth is, everyone has a stake in the health of the community, from families to schools to businesses. In the same way, the County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose, to build a culture of health county by county. But what should be our core priorities in building a culture of health? So in February, I wanted to share that a partnership, including the Robert Wood Johnson Foundation, along with other major national leaders in philanthropy, healthcare, and public health policy, reaffirmed their commitment towards these priorities of prevention and equity as the core priorities. They issued a declaration statement entitled, "We Stand for Prevention and Equity." This statement reaffirms the importance of place, or where we live, learn, work, and play, as being so important to our health. It also supports that this is the work of the entire community, and that we all have a role to play in continuing to pursue prevention and provide opportunity by addressing health equity to optimize fair inclusion of everyone and participation of all members of our community. So let's think about why this health equity work is so important. Another way to think about a culture of health is where everyone in a community has equal opportunity to enjoy good health. Or, at the population level, there's an attainment of the highest level of health for all people. I think it's important to think about this knowing that having opportunity is necessary before attaining health. Right? Ultimately, these are two ways to define health equity. You may be asking, how can we ensure that our work is creating health for all? Or, how can we move beyond a health equity lens to really applying equity as a strategy? Or what does health equity really mean when building a culture of health? It means creating a sense of community where all individuals, especially those most affected by poor health outcomes, feel they have a voice and a role to play in creating and implementing solutions. Healthy People 2020 states, achieving health equity requires, quote, valuing everyone equally, with focus on ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. So in 2016, Louisville, Kentucky won the Robert Wood Johnson Foundation Culture of Health Prize, and they centered their work on health equity for citywide improvements to address disparities. And they did this through areas such as housing, youth engagement, violence, and community healing. Let's take a moment to talk about some examples of conditions and policies that have led to current inequities, and also different types of inequities, such as those in race, age, gender, and geography. So since we're talking about Louisville, let's discuss disconnected youth as a condition that can shape current and future inequities. Disconnected youth is also a new measure that we're providing this year in 2017 so that communities can learn about how this issue affects them locally, and consequently, they can call attention to needed youth engagement. This measure is defined as youth aged 16 to 24 who are not in school or working. There's almost 5 million young people that fall into this category nationwide, and that's nearly 1 in 8 in this age group. We highlighted this work in this year's key findings report as well, which is also included in the handout section as a PDF with this webinar. So young people are considered disconnected from opportunity because they don't have the chance to get a quality education and gain experience with job training and work-ready skills. Youth facing these challenges are predominantly Native Americans, Blacks, Hispanics, and Alaskan Natives. And while the problem exists nationwide, it is more severe in rural counties. We can think maybe about what historic root causes there are for these disparities, perhaps things like segregation, relocation, and barriers for immigrant populations. The combined inequities of age, race, and geography can also have a compounded and worsened effect for youth in this population. But it's important that we attend to this issue for two reasons. First, this is largely an invisible population and represents an untapped social and economic potential of the next generation in our communities, or this kind of concept of social capital. And it's easier to prevent disconnection than to re-engage young people who have dropped out of school or have gone without work for a long period of time. But we are seeing communities taking action to create opportunity for youth. So coming full circle back to Louisville, they've taken an innovative approach to Youth Build, which is a national program, and have helped increasing numbers of young people get their high school degrees and also career training. Other effective strategies include building partnerships among schools, community organizations, and law enforcement to deal with things like absenteeism, and creating summer jobs, apprenticeships, and internships to help young people enter and stay in the workforce. So another example of health inequities involve treatments once people are in the workforce. So for our second example, we'll explore the wage gap between men and women. With the history of women being excluded in the workplace and women's jobs being differently valued than men's, there is a long-standing income disparity between men and women. This image from 2012 on the left shows women earning just 70 cents for every dollar men earn. And as you can see from the graph on the right, women were still only making 79 cents for every dollar men earn by the end of 2015. And this gap has a significant impact on families. As you reflect on your own work, we invite you to consider how you might work with those who are most vulnerable in your community and work to identify what changes are needed to improve health equity locally. So I encourage you to check out the links that Jan's sharing to our Health Gaps report and other tools and inspiring stories on how to address health inequities. So now that we've discussed why this work is important, let's review the county health rankings. And as we share the various components that make up the county health rankings and roadmaps, I would invite you to think about which pieces of this material information and our program are most useful to you in your community. Alrighty, so before we get into an explanation of the rankings, we just wanted to share that the 2017 edition, or the annual rankings, are now available on our website. This slide shows the thinking behind our rankings in general, or our theory of change about how rankings can be a catalyst for action that improves the health of everyone in the community. So starting on the left, we take population-based data that is collected by others, and we utilize this data to create an easy-to-use snapshot that compares counties within states, and is released every spring. This year was March 29th. But we produce rankings for a reason, because they get attention of media and can be used to start and broaden conversations about health in our communities. Those conversations can then lead to broad community engagement and multi-sector partnerships that can in turn select and implement evidence-informed strategies to address community priorities and finally, in the long run, improve health outcomes. So essentially, the county health rankings aren't just about numbers really, they're about this call to action. We also know that while simple in theory, putting this model into practice is very challenging. So we provide tools and assist communities in each area, and we'll talk more about these, starting with the rankings. So here's our rankings model, and this is one of the most important images we'll share with you today because it shows what we use to determine the county health rankings in every community. This model shows that there's a relationship between at the bottom policy, how it affects health factors, and eventually health outcomes. So now we'd like to engage you, the viewers, for a quick opportunity to participate in this webinar. So I'm going to launch a quick poll just to kind of gauge a level of familiarity with the rankings model here. So I will start that up. So you should be seeing a poll. Maybe now? Yeah, now you should be seeing a poll. And it's just asking if you could click one option. Have you seen the model? Maybe you've seen it but not too familiar. Maybe you're somewhat familiar. Maybe you're very familiar with it and you use it all the time in your coalition work. Looks like almost 3/4 of you responded. That's great. 80%. I'm going to shoot for 90. I'm feeling ambitious here. And that's good. We'll go there. And we'll share the results here. So hopefully you're seeing, it looks like about 15% of you have never seen it before. About a quarter of you are have seen it but really not too familiar with it. And then a good chunk, almost 40%, are in that familiar phase. And then a fifth of you or so are quite familiar. Great. So we'll keep on cruising. So the rankings make it clear that good health includes many factors beyond medical care, including housing, education, jobs, access to healthy foods, and more. And it shows us that all these factors impact how well and how long we live, or the health outcomes at the top. So starting from the bottom, we know that from the research, effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of our communities. Many health factors, which are the blue boxes, shape our community's health outcomes, which are the green boxes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes, again the green boxes at the top, to show how healthy each county is based on length of life and quality of life. So let's translate this theoretical model into a real-life example. Expanding early childhood education improves academic achievement. Higher levels of education lead to higher levels of income, which make it easier to access healthy foods, clinical care, and quality housing, which in turn can influence your health outcomes. So you can see that there are multiple factors that can shape the ultimate health outcomes. Jan will be doing a web tour in just a few minutes, and she'll show you a little more about the rankings in the model and specifically how to find the snapshot of health data that's specific to your county and also how to utilize the data. So now we'll continue with the overview. Our next stop is the roadmaps to health, or the how-to, if you will, of the county health rankings and roadmaps. So right now you're looking at a screenshot of our Roadmaps to Health Action Center, which now shows our new user-friendly Where to Start video on the right side panel you can see. The Action Center includes people, tools, and practical resources to guide communities as they build healthy places for all of us to live, learn, work, and play. So I'm going to go ahead and launch another poll, very similar poll, just a different question, and just gauging how everyone feels in terms of their comfort with the Action Center or engaging with it. or any part of it really. And generally, we see that more people are more familiar with the rankings model than the Action Center, which makes perfect sense since that was kind of our starting point. And about, so let's see, 70% of you voted. Let's see if we can get a few more respondents in. And 80% is pretty good for me. So I'm going to go ahead and close the poll, and I'll share it with everyone. Great, so it looks like just about a third of you have never seen it, a third of you have maybe seen it but are not really familiar with it, and then maybe just a quarter of you are in the other two categories. So that gives us good reason to dive in. So let's dig a little deeper. As we continue to explore the how-to of county health rankings and roadmaps, so I want to share with you this Take Action cycle. And the Take Action cycle and all of its resources provide a step-by-step guidance to support your work in the community. Communities can and are improving health by using these very steps in the Take Action cycle. So let's take a second and kind of walk through the steps of this cycle, starting at the top right. First, you want to gather information to assess needs and resources, then set priorities in your own community so you can focus on what's important. Next, you'd want to find the most effective strategies and approaches for your community to address your priorities. And we'll get to a great tool to work on this in just a bit. And then you want to get to work on acting on what's important. And of course, you're going to want to evaluate throughout the cycle. And this will help you to improve the strategies you're using, and it'll also help you to ensure that what you're doing is really effective. So importantly, you'll see that communicate and work together surround the cycle, because working together and communicating with partners, policymakers, and your community is continuous and ongoing throughout all the steps. And at the heart of the Take Action cycle, you'll see that all the people are engaged and working together. So because we know solving these issues, issues like childhood obesity, poor high school graduation rates, or crime and recidivism require the wisdom and resources and engagement of everyone in the entire community. So here's that other helpful resource I was just talking about in the choose part of the Take Action cycle. And it's called, I just want to highlight what works for health. And it provides communities with information to help select and implement evidence-informed policies, programs, and system changes that will improve the variety of factors we know affect health. It is found online in the Roadmaps to Health Action Center of our webpage. And Jan will show you how to access this What Works for Health resource in her live tour. The good news is it's much easier to find in 2017 due to some website updates. So I just want to quickly launch another very fast poll, and we're going to take another gauge of people's familiarity with what works for health. And if you're not familiar, again, do not feel bad. I did mention that it was hard to find a little bit in the website, but it should be a little easier, and we also have some resources on how to use it as well, which is great. All right, you guys are getting much faster, almost 80%. I'm going to shoot for 90. I'm feeling optimistic. The sun finally came out in cold Wisconsin, so. And 87's good for me. All right, so this is pretty typical. Yep, almost 60% of you have never seen it, and this will hopefully be something great to learn about today. About a quarter of you have seen it but have not really used it, and that's the best part about it, is being able to use it, and then about 20% of you are a little familiar with it. All right, so what it is basically is our evidence team here searches out and summarizes evidence for strategies that can move the needle on things like tobacco use, diet and exercise, and even more upstream factors like education and employment, like we talked about with the model. And you can search what works for health by the health factors areas, which Jan will show in just a bit. And also a new feature makes what works for health available through our county snapshots. If you're interested in moving from areas you see in your data directly to choosing strategies to take action. Many communities who are working in the choose step of the action cycle I showed earlier use this tool, What Works for Health, but it can also help you assess current strategies you're already using and also some alternatives that you may be exploring as well. So very broadly, What Works for Health is a menu of evidence-informed ideas containing over 380 strategies and counting. And by strategies, I mean ideas for policies, programs, systems, and environmental change. And by counting, I want to emphasize that What Works for Health is a living resource that is updated routinely to share new evidence and findings that reflect any changes in the literature, and also to add evidence that confirms the current status or adds new nuances or outcomes around existing or what we would call innovative and emerging ideas. One of the things I really like about What Works for Health is that it provides an easy-to-use searchable menu to help you look for evidence-informed strategies for the specific problem you're addressing. It's kind of an all-in-one place where you can find evidence ratings, which convey the likelihood that strategies will work based on available evidence, short literature summaries or lit reviews on the who of the strategy that it can benefit and the what it can do. And we also have a little information on cost related to strategies where it's available. We also include a disparity rating to help communities use an equity lens as they maybe explore strategies. And there's also a list of implementation resources to help really move from ideas to action. So if you need support in moving from ideas to action, our community coaches, which are at no cost to you thanks to the Robert Wood Johnson Foundation, are really an excellent resource. And lastly, a quick note on What Works for Health is that in summer of 2016, we created What Works Strategies to Improve Rural Health as a report, which is a great subset of What Works for Health strategies. And this outlines about 60 strategies that are specific to rural areas that can really help focus in on issues that are concerning rural areas. So those coaches I just mentioned, I wanted, when I introduced the Action Center a few slides ago, I wanted to mention that they are real folks. There's 11 of us, and we're scattered about the country from California to Colorado to Pennsylvania and to Florida. And this is just a picture of us all in October, back in this past October in 2016 in Madison, Wisconsin. And you can easily access us by just clicking on the Get Help buttons on the website, and we'll be in contact with you quite shortly afterwards. And just quickly to highlight where we do our work across the country, this is a scattered map of all of the works and the kind of, I like to say, the touch points we have around the country, both to engage in this kind of bi-directional learning of sharing what we see happening in communities and sharing that good work with other communities around the country. So before I pass this off to Jan and she begins the web tour, I just wanted to highlight a few key takeaways. So far we've discussed why this work is important. And we've reviewed the County Health Rankings model that shows us how we determine the rankings and also what influences health. And we've touched on roadmaps to health, which is again the how-to from moving from data to action. So let's take a quick second and tie it all together. So it takes everyone, all of us working together to improve the health of a community. Right. We need to move as quickly as possible from data to action, not get stuck in what is called analysis paralysis or drowning in the data. We encourage communities to look to the evidence to inform their actions, and if you innovate, be sure to evaluate. We have to keep focused across the health factors, including social and economic factors. We need to prioritize efforts to focus on creating better opportunities for health for all community members, especially those who aren't as healthy as others. And don't be afraid to take action on policy, systems, and environmental changes, which we know in the long run create the greatest long-term change in health for the children and adults and the next generation in our communities. All right, so that's our intro here. I'm going to pass it off to Jan, and she's going to work through taking you on a live tour of our website.
Great, thank you, Justin. I just need to share my screen and make sure that you can see my screen here. Great, so here we are. Nice job, Justin. Thank you for taking us through the overview. I'm going to give you all a live tour here as we walk our way around the website and go through the things that Justin just talked about. We are now at the home page, countyhealthrankings.org, and I'm going to give you some tips for navigating around the site and how to find different tools. So let's just start with this orange navigation bar at the top of the page. This is going to remain at the top of your page throughout the site, and it's a great way to navigate around the full site with just a few clicks. So no matter where you are on the site, you can always scroll up and click on that navigation bar, or just go ahead and click on the logo to get back to the home page if you get lost. Under the Rankings tab, you'll find information about our approach and our rankings methods, and also how to use the rankings data, go for a little deeper dive there, and measuring progress, as well as tools that will help you understand all of your data. Next to that, you'll see our Roadmaps to Health tab, where you'll find our Health Actions Center, and you'll also see what works for health. We can also go here to find stories of communities taking action. And you can learn more about community coaching if your community could use some guidance or a thought partner as you work to improve health. Under the Resources tab, you'll find your State Health Gaps Report, which Justin mentioned, and the key findings reports for the past 3 years. Those are national reports, so you can get a feel for what's going on nationally and how your community might compare. You'll also see here information on upcoming and archived webinars and also FAQs about our rankings and roadmaps. Under the More menu, you'll find our county by county blog, an About page where you'll find more information about our program, including publications. And here you'll find the RWJF Culture of Health Prize, where you'll find information on past prize winners, including their stories and videos. You can learn more about how you can apply for the RWJF Culture of Health Prize. And we also have up here some 2017 research grants and what those are all about. Also, I'll point out that there is a search window in this main navigation bar where you can enter your county, your state, or your topic of interest. Now, on our home page, you'll find a link to the 2017 Key Findings Report, which I mentioned you can also find in reports and resources. And as you scroll down, you'll find a map of the U.S. and a search bar here. And you can enter your county or your state name there and go to your county. We're going to come back to that in just a moment. I want to keep going down this home page here so you can see how it looks a little different from what we had before. When you come down the page, you'll actually see the Roadmaps to Health Action Center, and you can access any of the guides right here. Further down, you'll see what works for health, the resource, and what we've highlighted here are strategies that address issues that are featured in our National Key Findings Report for 2017. You'll also see a featured community story here, which is Manchester, New Hampshire. It's a great story about what they're doing to address some of the key issues that we talk about in the Key Findings Report. They're also a Culture of Health Prize winner. And finally, at the bottom of the home page, you'll see more information about the research grants again here. So I just wanted to orient you to what all you can find on that home page. There's an awful lot more here and than we had before, and it will be refreshed on a monthly basis. So it's a good place to come and take a look when you come back to our site each time. So what we're going to do now is take a look at a snapshot, and we're going to explore the measures within a snapshot. And for the purposes of this presentation, we're going to go to the state of Washington, which is the home of the RWJF prize winner, Shoalwater Bay Indian Tribe, which is located in Pacific County. Now, every state has their own state page, and what you see on the state page here is on the left, a health outcomes green map, and on the right, a health factors blue map. And as we scroll down, you'll see below the maps, again, your state health gaps report, which is another source of data for your state and local communities, and you can download that report right from this page to find out what's driving health differences in your state and what can be done to close those gaps, because we include strategies as well. And then you can also scroll down and see additional data for your state. And this is a good place to find more sub-county and demographic level data if you click on that More Data Resources. You can also see on this state page additional community improvement resources and community stories from your state. And finally, you'll see your Washington State lead, your contact here, in this case, Jennifer Zabel. So let's go scrolling back to the top. Hopefully I won't make your head spin. Justin, am I going at the right speed? He says yes, gives me a thumbs up. We're going to go back up to the top, and you can select your county either by going into the drop-down menu, or you can go to the map, either the outcomes or the factors map. And I'm going to go to Pacific County here. You can see it's right on the coast. And I'm going to click on the county that way. And this will take me to the county snapshot. Across the top of the snapshot, you'll see a number of tabs. And these tabs offer several ways to explore your data. You can look at individual measures. You can get downloads of data for your state. You can compare multiple counties. You can even compare counties across state lines. That was a feature we added last year. Before we jump into the data, I'm going to scroll down here just a bit. We've added a feature this year for understanding why ranks change. This is a frequent question that we get. And you might be wondering, so here's where you can click on to find out why. And there's 4 reasons at least why ranks change. So I'm going to leave that as a curiosity point for you all to go in and click on that to find out why. You may be surprised. I will say this though, ranks are not absolute, they're relative, so they are always in comparison to the other counties in a state. And that's one of the key reasons why they may change. So on a snapshot, we want to first understand what the data are measuring. In the first column, you'll see each of the 35 measures that we use to calculate a county's rank. But you might be wondering what exactly that measure is examining. You can learn more about the measure by clicking on the Measures tab up here, or by clicking on the measure's name from the snapshot. What I'm going to do is click on actually the measure that's in social and economic factors, children in poverty. I'm going to just click on that measure, and you can see as I hover on it, that's what it defines. It's the percentage of children under the age of 18 in poverty. And when I click on that measure, it brings me to the measure detail, or it actually brings me to the map of children in poverty. And you can see that the maps with the counties with higher levels of children in poverty are deeper blue, and counties with fewer children in poverty are lighter blue. You'll also notice tabs across the top here, and you can look at the detailed data for the measure, or you can see the description, where the measure comes from, and you can even see policies or strategies from What Works for Health that would address children in poverty. For the layperson, you can also click on Learn More about this measure, a new feature this year, to get a little more background about that measure. And to the left here, you'll see a brief description about the measure, and you'll see a bit about the methodology. So you see here that the weight of this measure is 7.5% in the overall rank of the county, and the number of years used is 1 year from 2015. As you know, or you may not know, what we try to do with our measures is always get the most recent that we possibly can that's available for every county in the country at the least possible cost. So that is a limiting factor in the measures that we can get, but it also provides data for as many counties as we possibly can. So for most counties, well, let me go back to, now that we understand the measures, one thing I want to point out is for children in poverty measure, and I think I'll go here. I think we're getting a question about, do we have measures sort of broken out by disaggregation. So let me just show that. For this particular measure, we only have it for a few. We do happen to have disaggregated measures. So you can see it by the county, the percent of children in poverty, and then if we have the data, you can see where it can be broken out by race. And so that's one of the measures in the ranked measures that we do have like that. Now I'm going to go back to the snapshot, and again, sticking to the top here, you can compare your county value to your state's value. Here for premature death, this is a rate, 7,500, compared to the state of Washington, 5,500, so it's higher than Washington's. You can also compare to the top U.S. performers, which is the top 10% of the entire country, or the 90th percentile. So this is a good column to take a look at if your county is doing quite well in a measure. It's an aspirational value that you can shoot for. Finally, for some of our measures, we provide trend graphs. If we have enough data, we can give you one of those. And the snapshot is just a single point in time. The trend gives you a moving picture, and that's a little bit stronger picture of what's going on. It can show you changes that have occurred for that measure over time. And we've added a new feature here. If you click on that little eye icon, for this particular measure, which is premature death, that icon shows you the leading causes of death under age 75 in Pacific County. And then you can also see for the trends, and I'll show you what we mean by trends, that if you see a red line, your county is getting worse. An sort of yellowish orange line, it's staying the same. A green line is getting better. If it's a gray line, it means additional information is needed to interpret the trend. And there's actually one of the measures we have on healthcare costs is a gray trend, because it depends on your community, whether that's a good news or bad news thing. So let's take a look at premature death for Pacific County. And you'll see that for Pacific County, their numbers are in blue here, their trend line, and the U.S. is in the orange, and then the state of Washington is the green dotted line here. And this year, a new feature is that we actually have the actual numbers underneath each of these, so that gives you a little more information there. So once you've explored and compared your data, you may have a good sense of what's going well in your county and what areas are in need of more work. But if you want a little more guidance, a feature that we added a couple of years ago is this areas to explore. You can click there. You can also click on, and that will flag in orange the areas that you might want to take a deeper look at. And you can also look at your strength areas. We really encourage communities to build on their assets and strengths. And every county, every community has strengths that can be built upon. So those are highlighted in purple. The county snapshot also includes additional measures that are not included in the ranks. And that's additional data that can be helpful to you. So you'll notice these with a little plus sign next to right down in here, the additional measures. This year, as Justin mentioned, we've added disconnected youth, and you'll find that under social and economic factors. Another additional measure that we've added this year is firearm fatalities. So definitely click out, check on those additional measures in your snapshot. Once you've taken some time to explore and understand your snapshot data, you might want to dig a little deeper to better understand health in your community. We always say the rankings are just a place to start the conversation. These measures are, you know, you're going to have much more local data that will add to your picture. So part of diving deeper is to gain a better understanding of who in your county is most affected by factors that contribute to poor health. So for example, who's using tobacco and who isn't succeeding in the education system, who's unable to access safe and affordable housing. And to help you with this, we've included some tools on our site to understand your rankings data and think about how you can measure your community's progress over time. So again, returning to our orange navigation bar, you can use the rankings menu to get to using the rankings data and measuring progress. And I think Justin's chatting out the using the rankings data link. So you can look for that if you want to explore that a little bit more on your own. I'm just going to pause here and see, are there any questions, Justin, about using data or anything I could answer at this point?
No, just a few questions came in that I responded to offline. One was asking if your data for your snapshot is available for download or anything. And yes, there's you can download the full Excel format of your county's data, and there's a download section tab. And a related question was also if there were links to the exact sources for each measure, and if you look under data sources too, it'll give you the exact resource that we use the data comes from, whether it be CDC or Burfus data or something like that. But that's all we have for right now, Jan.
Great, thanks very much. So one of the things I wanted to point out with using the rankings data is sometimes people want to know about, can I map the data? And this would be the place to go and find any mapping measures. And so under visualizing data, that's where you would find some of the GIS and mapping sources. And so that's a pretty good source right there. You can look beyond your assessments and dig deeper into your data and think through what other information you might need to understand health differences between subgroups. And then there's another section called Finding More Data that can direct you to additional national and state data sources. I also encourage you to take a look at this measuring progress part of our site. It's in the same area, and it helps you understand how to use the rankings measure to gauge your progress and where to look for other data that can help you tell your community's story. It can also help you sort of assess where you are on your progress on building a culture of health in your community. It's a really good conversation tool. So now we've spent some time on the health rankings side and we've explored the data. Think about now we're ready to do something about it. We want to move from data to action. So again, from the orange navigation bar at the top of the page, we can use the Roadmaps menu to get to the Roadmaps to Health Action Center. And as Justin mentioned, this is a new feature on this part of the site. We do now have a short video, it's about 2.5 minutes, describing what's in the Action Center and how to navigate its many resources. In the Action Center, you'll find guides for each of the steps. They're over here. There's also guides for all the partners involved in improving health in a community. And you can also see the guides right there in the action cycle. And as you move your cursor over each of the steps here, you can see what that guide is about. It is interactive, so that's a good way to check first to see what you want to dive into. There's also, what I want to do right now is I'm going to bring us down to the Choose guide because I want to show you a couple of new features that we have, and we're going to be adding more to this resource here. So again, in the Choose Effective Policies and Programs, it tells us what it's about, how it's about, helping us, how we'll know if a strategy will work and how to pick the right strategy for our community. And when I click on that, we'll see a description, its purpose, and now we've got the top tools that are recommended by our coaches and communities, what they really like to use, what they use the most. We also have a new feature called a shortcut, and we're going to be adding more of these as we go along. The shortcut is a quick PDF that you can download and share with your partners, and it helps you describe where you are and discuss where you are in your work in this part of the action cycle and the challenges that you face. And you also see key activities in each of these guides. In this case, we have 7 key activities, and each one of these provides relevant guidance and tools for where you are in the step. And when you look at this, look for the activity that is perhaps your community health challenge, and then you click on that activity. So let's imagine it's a community that's already got a pretty good handle on what's going on in their community. They've really got a good feel for what the community residents want, where the inequities are. Now what we want to do, and we know what our goals are, where we want to improve, what we want to improve, what our priorities are. Now we want to explore what strategies can really help us. So we're going to click on Explore Policies and Programs. And when we get there, we'll see a number of tools on the right that can help us work through this process. And there'll always be up to 5 tools visible. If there's more than 5, you'll see View All Tools. In this case, there's just 5 tools for this key activities. Sometimes for a key activity, you'll see a quick tip video. And in this case, Justin had mentioned the Rural Health Strategies report. This is a quick video, about a minute and a half, telling you about that report on strategies that work in rural communities. Now, one of the tools in this key activity is What Works for Health, which we described to you before. It's a rich resource of almost 300 strategies that we've looked at for what really works in communities, and we rate the evidence base. Now, you can get there through that orange navigation bar, as we talked about before, right here, or you could find it in this actual key activity. We're going to take a look at What Works for Health in just a moment. We also mentioned that throughout the Action Center, to get a hold of a coach, you can just click on Get Help. These are throughout the Action Center, and you'll get personalized free help, usually within 24 to 48 hours. So that will take you to one of our 11 community coaches based around the U.S. Now, let's look at one more way to find tools. Before we go to What Works for Health, we can go back up to the orange navigation bar and click on Resources, and then on Tools and Resources. So if you know what your topic is, you can actually put that into the search bar there, and then on the side here you can see what type of resources we have. So if you don't want to work through an Action Center guide, you can actually go right into that Tools and Resources section. So now let's take a look at, back up to Roadmaps to Health on the orange navigation bar, What Works for Health. This is when a community really wants to know what action should we take, what intervention, what policy or program will be effective. As I showed you, we have a whole step that's called Choose Effective Policies and Programs and Take Action in the cycle dedicated to this. And we have one tool in particular, and that's right here. And it's on the right. You can see the new or updated policies and programs, and those are continually being updated. And on the middle part of this, you'll see another shortcut. Again, this is a PDF. It can guide you through, I think it's just 5 quick steps to work through finding an evidence-informed policy or program. And scrolling down, you can see our 4-minute tutorial for an overview of how to navigate What Works for Health. Now, to learn more about a strategy, you can scroll down and actually click on one of the health factors of interest, or you can enter a keyword into the search box. Each reviewed strategy is assigned an evidence rating based on the quantity and quality and findings of relevant research, and you can find out more about what our ratings mean in our ratings tab on the left toolbar, or actually when you go into a strategy, you'll see what the evidence rating is. So let's just imagine here that we are back in Pacific County, Washington, and our original inquiry that we had in the snapshot was around children in poverty. So let's imagine that we've got a pretty good feel for what's going on in terms of the data. Now we're looking for a strategy, and we want a strategy around income, something that's really going to affect families and children. So I'm going to click on income and see that I have 16 results here. And we can further filter those results on the left here with these filters. So we can look at approach, which another way of thinking about that is a goal. So if our goal is to increase or supplement income, we actually have 10 strategies for that. If it's to support asset development, we have 6 strategies. Or we can filter it by decision makers. In this case, you'll see that we have all 16 strategies involve government. 1 strategy involves a business leader, and so forth. We can also look for the evidence rating. So if we're just interested in those strategies that are scientifically supported, there are 3 that are scientifically supported. So I'm just going to click on those 3 so you can see how to navigate here. And I'll show you what the earned income tax credit strategy looks like. So over here is the evidence rating. Then we've got a description of that strategy, what the expected benefits are, what the evidence is and the sources of that evidence, whether or not it will impact disparities. In this case, it's likely to decrease disparities if it's implemented the way that it's described here. And then we also have examples underneath that. And if you feel like, oh gosh, that's just not hitting what we want to do in our community, you can come down here and look at related policies and programs, and it'll take you right to those related policies and programs. Another added benefit is sometimes throughout What Works for Health and also in the Action Center, you'll find a community in action. That's going to be a community that has actually used that strategy, and if we click on that, it gives you a little description of what they did and also how to connect with that particular community. So that is it for my tour through the website, and what I'm going to do now is hand it back to my colleague, and if I could, need to get it back to you, Justin.
As Jan's working on that, I did have another question that
good.
that reeled in, and it's just pretty simple question. So how often is the data updated? So like I said, on the 29th, we had our annual rankings release. So every year annually, we update the rankings of each county. However, the data we use, like we said, for various measures comes from different resources. And we use data as new as it is available, but based on those resources, it could be, you know, for example, a 3-year 2012 to 2015 data that we're showing in 2016. So we provide that information with each specific measure and each resource that's linked to it. So we use the newest available data. However, if this question is really getting to that sometimes there is lag between what maybe you're seeing in community and what our more generalized national data shows, we do encourage, of course, finding ways to gather that data locally, both quantitative and qualitative data. So thanks, that was a really good question.
You know, I would like to just add to that and build on that too, Justin. It is a good question. We have, in addition, I'll just underscore this, at any time throughout the year, we add additional data for states, and it's really amazing what's available on each of the state pages. So if you have additional data that you know about at the sub-county or demographic level, census level, whatever it might be, please contact us. Let us know. We'll put you, or you can get in touch directly with your state liaison, who I showed on the state page, and just let them know that you've got some additional data that you would like to see included for your state, because as we know, again, the rankings data, that just comes out once a year, and we only use the data that are available across every single county, so that does limit it. And we know that local communities have more data that's available at a more granular level.
Great, Jan. Thanks. So we are cruising right along here, which is great. So I'm going to kind of bring us home since we just have a few minutes left. I wanted to first thank Jan for that fine tour, and then I wanted to just highlight again the Culture of Health Prize, Robert Wood Johnson Culture of Health Prize that she brought up a few times during the tour, and I think I brought up earlier. But the 6 criteria that are displayed on this slide kind of drive the selection of prize winners. So the 2016-17 cycle for applications is closed, and under review, but it's still a great time to really think about how your community may be meeting some of these criteria and could be a strong applicant for 2018. And just for a little inspiration, these are our recent winners of 2016, and you can dig more into looking at these communities. There's some great little vignettes, some videos on the Culture of Health Prize website, and they are Louisville, Kentucky, Santa Monica, California, Miami-Dade County, Manchester, New Hampshire, Columbia Gorge Region, and a really unique collaboration of the 24-1 community, Missouri, which is 24 connected municipalities in the North St. Louis area, and the Showalter Bay Indian Tribe, which Jan brought up during her tour. This map just kind of shows where throughout the years some of our prize winners have been across the country, so great to take a look at both this past year's and prior year's winners as well. And then I just want to wrap up here with just kind of some things to move forward with, and we think about these as kind of focusing in on the D's, if you will. So first we'll think about differences, right? So investigating the differences, using digging deeper and other data tools to understand the differences between the groups of people in your community. Next is really the drivers, so focusing on the drivers that most influence health. What we were saying are the policies, systems, and environmental conditions that create opportunities to improve health for everyone in the community. And then digging, so digging deeper into the root causes of these, right? While all of the health factors affect health outcomes, be sure to focus on the ones such as social and economic factors that may contribute the most to poor health conditions. Determine which strategies are most effective, and we've gone pretty deep into what works for health as an example of a way to do that. And finally, do it. Right? So harness the collective power of your community and really take action and create more equitable opportunities for good health for everyone to have that same opportunity within your community. So thank you very much for partaking in our overview and our web tour, and I want to open up here if we have any more questions. Maybe Jan can check if anything has come in the last few minutes or so.
Yeah, actually, I just want to underscore again, if you've got questions that are local to your community and or perhaps a question that's kind of deep in the weeds, please encourage you, we both encourage you to just come do the Get Help button, and that'll link you directly to one of the community coaches, and then we can have a more in-depth conversation with you. That is a good way to get in touch. Just want to clarify one other thing, and Justin will show other ways to stay in touch with us. The blog that we have is one that we write, but there are other ways to stay in touch with us and stay in touch with other communities as well, and Justin will talk about that in just a moment here. I don't see any other questions, Justin, so thank you.
Sure, thanks, Jan. So just really quickly, some upcoming webinars, and we hope you've enjoyed this one, but we have some great ones coming up too that are a little more specific in some issue areas. On April 18th, we have one called Advancing Health Equity Through Strategic Partnerships. And then on May 23rd, we also have one called Collective Impact in the Real World, From Common Vision to Collaborative Evaluation. And you can register for these online and also read some more in-depth descriptions on them as well. We'll chat out a link to our webinars page, which shows both past, present, and future webinars that are coming up. And as Jan mentioned, just staying connected is important, right? So using social media to stay in touch and share about communities. You can use Twitter. You can find us on Facebook. We have an e-newsletter that goes out as well. And you can sign up for that. And just lastly, since we're down to the last minute or so, just a quick few reflection questions, and we'd just like you to really consider as you leave this webinar, maybe who else do you need to share this information with? As you think about all that you've heard today and the resources we reviewed, who else might really gain from learning about it? And what is one idea for action that you're taking away from this webinar, or how can you ensure that you're putting some of this knowledge right into practice? So lastly, we just want to thank you again from us here at the County Health Rankings, and please join us again for a future webinar, and we hope you all have a lovely afternoon.